basically you may easily get bored. You want to gain control very fast. You have you have poor problem solving skills because you're under so much stress. And these are all caused by issues that are happening in your life.
Mm-hmm.
And of course, like I said again, it's not a genetic, because some of these stresses are genetic, and
Mm-hmm.
that may require even more intensive treatment like
But
medication and psychotherapy.
we are talking about a different kind of stress, and this one you mentioned is a third one, right? And with
Third
you,
one,
you, yeah, you didn't mention about the genetic one, right?
the
Not yet.
genetic one is the, yeah, I haven't said that yet. But then
Okay.
we come to the fourth one. There
Mm-hmm.
is a
Please.
fourth category, and of course there is a lot, but the fourth category is the most severe,
Mm-hmm.
which some people end up committing suicide.
Mm-hmm.
They attempt suicide, and of course some people commit, and they obviously pass away. That is called a post-traumatic stress disorder, which is a much more severe stress. And of course, in the past, after World War II, it was assumed that some people are not receiving, not really being shell shocked. They're under post-traumatic stress, like meaning that they have had a severe trauma that has happened in their life that has affected them, right? So
Right.
that right now we know that in some other cases it could be a severe domestic violence case where the husband or the wife beats the other one for a very long time. So they're exposed to severe trauma for a very long time. Or child abuse, children that are abused consistently, repeatedly, and sort of non-stop environment. They're under a serious stress of maybe physical abuse, sexual abuse, emotional abuse. Those people also get post-traumatic stress. So when I said predisposition, is when you come to a situation like COVID-19,
Right.
if you have that predisposition, that post-traumatic stress, right now, this stress is not just something you can take care of fast and easy on your own. You don't have the ability to fight this off and take care of yourself. You know what I mean? So
Right.
this is where I think when you come to post-traumatic stress, serious help is needed. You
Mm-hmm.
seriously need to see a mental health professional, and that's when you really recognize it. You can see it's affecting you physically, mentally. It affects your relationship, your work. Almost everything about your life is crumbling around you. Everything
Yeah.
is falling apart. That's where you're
Exactly.
under severe stress. And of course, some people hide it really well.
Yeah.
They don't
Exactly.
show it until you find out. I had a friend myself, and of course, this was a long time ago. He was only 24 years old at the time, and he shot himself. The night before, we went to a party. He was having a great time. He talked about his life, and everything is so beautiful. The next afternoon, we found out that he left a note on a computer for his brother and shot himself in the head.
Wow.
And he
Yeah.
couldn't deal with the
PD.
stress anymore. So
Yeah.
we have to be
PTSD.
very
PD.
careful.
Yeah. PTSD is a very
I just don't want to
serious thing.
scare people, though. I don't want to say something that people get scared. Please don't think that if you're having any of these symptoms, because sometimes, and I have to be honest, because people do that,
Mm-hmm.
as soon as a psychologist or some expert opens his mouth and they associate a symptom that he expresses to
Mm-hmm.
as something that they're experiencing, right? So then they
Mm-hmm.
say, "Oh my God, I have it." And I remember in the beginning of in the first 2 3 weeks that people were staying home,
Mm-hmm.
people were calling me. They said, "I have COVID-19." I was like, "How the hell do you know that? Did you see a doctor? Did you test?" No, because I have this chest pain. I can't breathe, and I'm like, "Okay, that could be stress." I'm
Mm-hmm.
not saying don't see a specialist, but this symptomologies that you are explaining to me is not COVID-19. So
Mm-hmm.
it's better not to immediately label ourselves and say, that I am this and that. It's better to just get some professional assistance just to make sure that we know what we're talking about, rather than just
People.
looking at a car and assume it's a V8 engine. We don't know that. Unless you actually had that car, you have to open the
Mm-hmm.
door, read the
Mm-hmm.
specifications, or ask somebody who knows. So I would suggest it's better to seek professional help to make sure you're not just labeling yourself, because that's also an added stress you don't need. You
Right.
don't need
Right.
that.
People
There are,
labeling are themselves very fast on physical issue, but on
uh,
mental, no.
it, yeah, we do that all the time, right? And
Yeah.
sometimes, to be
Physical,
honest
but
with you, and I don't want to be excessive on this, but we do have distorted thoughts of ourselves. If you really look at it, all of us, including myself, we may have a view of ourselves that may not be it may not necessarily be true. This is just our view that we have of ourselves. And to be honest, human beings are big time critics of themselves. Most of them, unless you're a psychopath or you have a grandiose personality or the other issues that we see in a lot of other people, you're the worst critic of yourself. You may look at yourself
Yeah.
and say, "Oh my God, I've gained so much weight. I gotta lose that weight," or "Why do I look like this?" or why did I talk like that? And somebody else might actually look at the way you spoke and say, well, that was fantastic. I remember I did a
Right.
seminar. I came out, this was 2, 3 years ago, and I came out of there and I'm like, oh my God, my accent. I hope people can forgive that. And one of my colleagues said,
Yeah.
what the hell are you talking about? People were paying attention to the topic. They didn't care about your accent. Dude, let's just go have dinner.
Yeah.
You be quiet. And it's
Right.
true because then they invited me again. So when they invited me again, I knew I did okay because this was in UCLA. And yeah, when I got re-invited to do another seminar, I said okay. So then I did okay. But we do criticize ourselves. So I'm hoping
Yeah,
during
a
this
lot.
time,
Right.
because we do have cabin fever, which is what I explained last time. This cabin
Right.
fever could be dangerous. At the same time, it could be very manageable. We should not labor ourselves. This is a very difficult time. A lot of people are not seeing their family members. They may not be being so much in touch with their kids. They may have some illnesses that they can't deal with right away because their doctor's office is closed. I mean, I have clients who have told me I cannot go see my doctor. I have a lot of issues with my back, but he doesn't want to do physical therapy. He says just deal with it for now. He gave me prescription to go to the pharmacy. So and then they have a family conflict. They have financial issues. Some have, a lot of sexual dysfunction that is now becoming even a bigger issue because it's not stressful for them. Array of
So,
issues.
Dr. Payam, Kate, how we can manage it? There is a lot of things. How we can
Yeah.
manage?
That's a million dollar
Oh,
question.
that's $1 million question, but I have to say some of it can be manageable by ourselves. Oh, I apologize. I think I lost the picture. Let me
No
see if
problem.
I.
You're coming pretty fast.
Okay.
You're coming. Yeah, you're coming fast. If you can, yeah, you're coming back. Right, right. You are good. You are good. Just a
But
second. Okay, you are good. Go ahead, please.
I'm back. Okay.
Right.
So one of the things that I'm hoping people do not do is have a false sense of cure. What do I mean by that? Oftentimes, and I don't know if I have time to speak for a couple of more minutes.
You
Do I?
have
Do I have
time.
time?
Yeah, of
You
course.
have to.
Yeah, you
Okay.
have time
Okay.
always.
The false stress, the false cure for the stress is when people think, well, it's nothing, I can manage it myself. So instead of having a glass of wine, they will have three, right? So they pass out. Or they start using more drugs. Seriously,
Yes.
they start using more drugs.
Hmm.
They may avoid the problem and say it's not a big deal. It is not a problem. They may joke excessively. If you see somebody joking all the time, that, I mean, not necessarily this is the sign, but this is one of the signs. And then of course what they do is they start blaming other people for the problem. They don't want to take responsibility. So it's you did this, you did that. So they
Right.
put sort of the stress goes out of their body sort of, but it's a false cure because after a little short period of time it comes back and it actually becomes even more excessive. So in order to manage it, I would say that one of the first and the most important thing to do is to know 100% that you are not going to die and nothing is happening to you unless you're suffering from a very serious, God forbid, illness, which is cancer or something like that, right? Or you have, God forbid, COVID-19 or one of these stuff. Then you need professional help. Other than that, the first thing that I would tell people: try to stretch your arms, stretch your body, because muscles hold a lot of this stress in a toxic way. They hold it in the muscles, right? You need
Right.
to
Hmm.
stretch your body to get rid of the toxins. Drinking a lot of water. People laugh at me, but believe me, it does help. It reduces stress.
It
It
really
reduces
do.
hormones. Yes, you have to be, because dehydration, if you look at any psychological book, any document that is out there, it will tell you dehydration is one of the sources of stress. And people laugh at me, but hydration is so important. Alcohol actually does dehydrate you. And people think with alcohol I'll resolve it. And they don't. It actually has a negative effect. So, and then obviously one of the things that I would hope people do is make sure you exercise. Like, go for a walk. You don't have to do jumping jacks. You don't have to do anything crazy. You don't have to do a marathon tomorrow morning. Just go for a 20-minute walk a day if you can, early in the morning, right? Make sure you can balance your sleeping if you can.
Right.
Minimize TV time during
Yeah.
sleeping time, because that would cause issues and you're not going to be able to sleep. And I know
And
people say I sleep better with TV. I'm not going to fight you on this. I'm just going to say, if you do that, eventually your body gets used to sleeping at a certain time, and it helps. And of course, there is a lot of other things you can do to
I
manage the stress. Uh, you know, like seeing yourself in an array of light, all this other stuff, the meditation that other people teach, other
Right,
techniques.
right. And you mentioned about the sleep. Sleep at night is very important. How much is important?
I would say for sure. I am not an expert on sleep, but I have anything that I've ever studied says at least 6 hours if you're over the age of 50.
Yes,
If you're
6 to
under the
8.
age of 30, 8 hours. If you're under the
Mm.
age of 30, especially for teenagers, they say 8 hours is minimum. It should
Okay.
be about 8 hours minimum of sleep.
Nilüfer, you
But
should sleep
older
8 hours.
adults, 5, 6 hours.
I sleep
Nilüfer,
eight
8 hours
hours.
for
I
you,
really
three
love
No,
hours is
sleeping.
good.
nighttime, but nighttime.
I love
but
sleeping and
but nighttime.
drinking. Like that's something. Wait, it doesn't matter. It's a
It
nighttime
is.
in Iran.
No, no.
My time is
Oh,
like
she sleeps. She sleeps nighttime based on here. Okay.
But it is,
no. I'm
it
just
is,
I just say it as a joke. But I sleep 8 hours, but
honestly,
it's not
sleeping is very
because
important.
yeah.
Thank you so much for your time.
Sleeping.
I I know
And
you're
the other
and
thing I
you're.
would suggest
Go
is
ahead.
deep breathing.
Oh yeah,
Deep
it's
breathing,
very
Deep
very
yes,
important.
breathing. Yeah.
yes, yes, and
Extremely. Close your
yes,
eyes and deep breathing, but you have to count it. You can't just breathe in, breathe out. If you have to breathe in, hold it, and breathe out with one, two, three, four counting, because it would reduce your heartbeat and you'll slow down, you calm down. Sorry, I didn't want to
exactly,
talk
and
too much.
And it's
at
really
least
good
five
for your
times, and it's
yeah,
at least
it's really
five
good for your
times.
skin as well. Like when you if you want to have like a good skin, really it's a beauty
Yeah,
secret that you have to sleep and also
yeah.
drinking water and also breathing. That's the key for having a good
That
skin.
that's why my skin looks good, because I sleep
Yeah,
well.
that's why you have a good. Is my skin is good.
I do.
It's genetic for me. This comes from my mom.
No, but I
Thank
can
God for
see the
that. Yeah.
difference. I can see the difference when I have like a
Yes.
sleeping problem, or sometimes I miss when I work. Like I always like after this, I always have my mug and I always drinking during the day. But before that, I didn't know. Like I feel like I'm getting old. I see the wrinkles around my eyes, and I find
You
out that
know,
it's
Come
because of
on.
the bad sleeping and because of the
it's
dehydration.
it is 100% linked to that. People start losing hair sometimes.
Mm-hmm.
They see
Hmm.
the wrinkles, the muscles tense up. All of these are stress. You start getting back pain or neck
Yeah,
pain, and you don't know where you got this from. These are all signs of stress. You see that your shoulders
exactly.
are becoming very hard, and these are signs of stress. And yes,
Mm.
dehydration is serious, and sleeping. I would say if you want to do two or three things, it's breathing, exercising, sleeping, and dehydration.
Meditation,
Drinking a lot
meditation.
of water, meditation.
Yeah.
Very,
Right,
very
right.
important. Yeah.
Yeah, and
And if it's a
every.
genetic factor involved, see a
Mm-hmm.
psychiatrist or a psychologist to get some professional help too.
Right, right, right. But you don't see
Mm.
patient, right? You just working with the your day job, right? Do you see patients?
I do. I do, yes,
Oh,
I do,
good.
but mine is not really working on stress management. I'm more of I evaluate people for what they have and I send the report to the court.
Mm-hmm.
But I do some
Mhm.
here and there. I do see people. Of course, I
Okay. People
work with
can
some people.
find
I have two
you.
patients.
Where people can find you? On your Instagram with your same
if
name
they
or
if they want
website?
if they want to find me under, yeah, they can find me on Facebook, Instagram, Messenger, under
Very good.
Payam Kate. They
Okay.
probably find me under Payam Kate is
Yes.
probably the best way. Or if they go to themindquest.com. But I would
Yeah.
say probably Facebook, they will
Yeah.
easily find me. Yeah, if
Yeah.
they want
Facebook
to,
and Instagram
yeah.
is easy, and yeah, the people can see
They
the
can't
name.
expect me to immediately. Yeah,
Oh,
hopefully they won't
definitely.
expect that I would pick them up
Definitely.
as a client right away because I'm very busy. But and I don't want to be a negative person. But if I can't help them, I can always refer them to a colleague, someone else who can
We really
definitely take care of
appreciate.
them
Thank you so much
for
for your
sure.
time,
Thank you
Of
so
and
much
course.
for your
have a
time.
wonderful weekend. If
Thank
you
you.
don't
You
if you
too.
don't have any plan for Sunday, call me. Maybe we can go for biking.
Oh, can you
Well,
bike? When
Sunday
can?
is my kid day.
Where?
I'm starting
Actually, I
from
don't
my
know if I
home.
can. You
Yeah,
can.
going to
Oh,
beach
good for you.
area and always be cheating and doing something, going to the somewhere.
That's actually I don't know about cheating. You want to be careful when you say that.
No,
I
but
don't. I don't
I'm
cheat
talking about the
myself.
biking because
Breaking the
they
rules.
close the road. They close it, but it's still people,
Yes,
Oh.
yes, they have.
they jumping.
Yeah. Actually, right before the call, 2 hours ago, I went to Santa Monica and I had to
Yeah.
drop off my computer, and some roads were closed. Yeah,
Right,
some
right.
roads were closed. Yeah.
No.
Thank you
It
again. I
was nice seeing you
appreciate.
both.
It's a pleasure. Appreciate. Thank you
Yeah.
so
Thank
much.
you.
Thank you.
Same
Have
here.
a
Thank you.
wonderful weekend. Bye bye.
You too.
Bye.
You
Thank you.
too.
Thank you
Take
for
care.
having me.
You
Bye
too.
bye.
Bye bye.
Bye bye.